Okay, we'll just give it another minute to make sure everyone gets brought in, and then we'll go ahead and get started. Okay, well, I just want to welcome everyone to our FFP TTA that we'll be joining today with our contractors, BCG. I wanted to let you know that DHCS has been working with BCG over the past 18 months or so, and we've been providing intense technical assistance to our counties throughout California, primarily focusing on increasing FFP drawdown, but we do have other topics that counties were focused on and asked for additional support on. BCG has developed several technical assistant documents that will be provided and posted to the service center that is hosted in the portal, and will notify counties as soon as they become available, hopefully within the next month or so. But with that, I'd like to pass it over to Naomi to get us started. Thank you.
Thank you so much, Teresa. As Teresa mentioned, our firm, Boston Consulting Group, has been working really closely with a number of counties across the state to increase federal financial participation drawdown. Today, we're going to be talking about targeted case management, billing guidance, and specifically how we have worked with certain counties to develop training materials to really help staff on the ground. You can think of this session more as a training focused on the process of creating guidance than on explicit targeted case management guidance itself. We built these materials for one county, and they will need to be adapted to fit your context, be approved by your quality teams. But as Teresa mentioned, it will be available to you. We are going to start with a quick Slido activity, a little quiz to get us going. So Patrick is going to go ahead and share a screen. You can join by going to slido.com in your browser and entering in this 7-digit numerical code. Or if you'd like to join using your phone, you can also use that QR code through your camera. So we will go ahead and answer a couple of questions once we have folks join. You can join using your name or anonymously, however you prefer. We're calling it a quiz, but nobody will be graded on responses. It's just to get us going. Wait another couple of moments for folks to get in there. All right. I think we can start on our questions. Which of these activities can be billed as targeted case management? Independently researching housing programs, referring a member to housing program, having a conversation with your supervisor about which housing program would be best for a member. You can go ahead and give your answers. Uh-oh.
Quiz
Hmm.
has a mind of its own. Give me a moment.
Sometimes it happens. If we can get this
There
to
we
work,
go. We're
that's
back to it. We're back
fantastic.
to it.
All right, go ahead and give your answer, and then we'll progress. All right. Fantastic. You all are really good at this. And I think what we are going to see is that you all will be really good at these questions. You are engaged in a lot of this billing guidance. And what we have found across counties is that it is really, really common for folks at the leadership level to have a handle on what exactly counts, what should be captured in the day-to-day day, but it can be really hard for staff to recognize when they're doing targeted case management and then starting to build on that to actually document it in a progress note. We have another couple of questions to, keep testing this, but I think what the real point is that getting some of this information and being able to pass along this knowledge to staff can be tricky. Why don't we go ahead to the next question? All right, true or false, only licensed staff can provide targeted case management. And I will share that a lot of these questions are built around the conversations that we've had, some of the misconceptions that have come up through our experience with multiple counties kind of engaging on this topic and building out trainings. This is false. Yep, you all are killing it once again. But this is something that we see a lot. People don't know that they are able to bill for these services, to provide these services. And so it's a lot of revenue that ends up being left on the table. Another question, we have a few of them just to get the flavor for this. If a case manager leaves a voicemail and faxes some referral paperwork taking 12 minutes, which is over that minimum billable duration of 8 minutes, how should that activity be documented? Okay, and here is where we see a little bit of divergence. And targeted case management is one of those services which is very ambiguous. It is not happening in a 50-minute period like an individual therapy session would happen. And it can be very hard to draw the line, both for yourselves, for staff. So the answer here is actually that this is going to be non-billable because of the way that the provider was interacting with the other supporting persons and the activities themselves. We can continue on to the next one, and then I think we are starting to get the point of this, which is that there is a lot of variation in what information that we have about targeted case management looks like. So building on that, TCM services can be delivered in which of the following ways? Fantastic. Okay. And here is another misconception that we have seen in a number of counties with a number of folks that we have spoken to. There are actually a broad range of stakeholders that can be involved in targeted case management. And so it's not just going to be the member, it's also going to be their significant support person. So it can be their family, other members of the care team, or even people that work outside of your organization but are heavily involved in the member's care. All right, one more question, and then we will get on to the good stuff. A case manager gives a member a bus pass to help them get to appointments. How can this activity be shifted to become a billable TCM service? So we've wrapped a couple of things in here. Clearly, this is a linkage, but maybe not to the fidelity of a true service. Oh, and you all are so good and you have gotten it. Well, that is fantastic. All right. Thank you for indulging us in this little quiz. Hopefully we learned a thing or two, and now we can move on to our broader presentation. We will go ahead and share our slide. So again, those questions were really designed to reflect some of the confusion we hear from staff across counties. If you want to go to the next slide, Pat, what we are hoping to do today is really get a sense of the value of providing and documenting targeted case management, both for members, for the county, This is stuff you already know. That is likely why you were here. And then also, we just want to share some of the experience that we have had across counties improving compliance of TCM documentation and making sure that there are really clear next steps on providing some of this training to direct service staff in the county. They are going to be what so much of this hinges on. So what we'll do is we will continue through, and then we will have some time at the end for questions, and also a survey in which you can write some questions out, and we'll get back to you after if we don't reach them during our dedicated Q&A. All right. So why did we focus on targeted case management? There are a number of services which direct service staff need help learning how to recognize and document, but why did we focus on this? The first reason is that TCM is really foundational. Members face real world barriers to engaging in behavioral health treatment. And so that could be transportation, that could be housing instability, that could be just difficulty navigating all of the systems that are coming together to provide them care. Targeted case management is the service that removes some of those barriers and can determine whether someone is actually able to show up to their therapy appointments. So there's a really important clinical piece. And then the second piece is that across counties, we've heard that there is a very consistent billing gap. So targeted case management is frequently delivered, but not documented or billed for. Case managers, rehabilitation specialists, mental health workers, a number of different folks across counties and across other provider organizations are doing this work every day without recognizing it as billable. So time isn't being tracked, notes are not being written, and that is revenue left on the table. It also makes that super valuable work invisible in the data. And so what we noted from this is that there is opportunity for staff to understand better what targeted case management is so they can provide a really valuable service and also draw down some of that funding that is going to be so vital for counties and providers to be drawing in these environments. So what we're going to do is we are going to go through a small subset of the targeted case management training materials that we have created with one county, and then we're going to talk through some of our learnings, our key takeaways, the process of designing these materials so that you all can, one, take this training and give it to staff, and two, really be able to create trainings in the future for other types of services that get at some of these really key questions that staff tend to have. Again, full materials will be shared with you, but think of these as a starting point, a living document, and make sure you carefully review them with your quality teams. Make sure the examples fit for the staff that you want to provide the training to before you actually go and provide that training. All right, we will now jump into some of these materials. So a good place to start is often, what is the service? What is the baseline? What are we trying to do? And so targeted case management, the DHCS definition is a service that assists a member to access needed medical, educational, social, pre-vocational, vocational, rehabilitative, or other community services. That's a broad definition. So what we think helps for staff is to really break that down into what that means for a specific county. And so this is a long list of what those services could look like. This is where you'll want to adapt and make sure that these are things that really align with the services that your staff are going to be connecting members to on a day-to-day basis. Some of these might not be relevant in your situations. There may be something that is missing that you all connect clients to every day. Make sure that these examples are what your members tend to need. The more familiar the examples are, the more staff will recognize their own work, their workflows in these examples. And so that's going to be something we come back to time and time again, but really making sure that staff recognize where this is relevant to them and what they do day to day. A common complaint that we have heard about trainings in counties is that it just doesn't feel relevant to the staff that trainings are being provided to, and that causes people to tune out. If we want to go to the next slide, another thing that is helpful is really laying out what exactly the activities are that count as targeted case management. Again, these should be adapted to really reflect what your providers are doing. But these activities can span a number of different categories. And so the most common one is going to be communication, coordination, and referral. And then there are a couple of others that might not feel as clear to staff. So monitoring service delivery, monitoring the member's progress, placement services, and plan management. And what we have done here is listed a couple examples for each of these to try and help represent all of the different things that targeted case management can look like. You'll see that there are a couple of notes for where some definitions diverge. And so one thing that we have seen as another, recurring confusion for staff across counties is some of the distinction between targeted case management and plan development. And so another thing that you'll want to do as you adapt these materials for staff is try and see where are the questions that come up most for your quality teams, or what is it that you see most in chart audits, chart reviews that are really specific to your context. We can move on to the next slide. How can the service be delivered? If you recall back to our quiz at the beginning of this session, this is really tricky for people. We have an idea of how certain services can be delivered that doesn't always align with the current guidance. And so it can be really important to grab some of those other opportunities that are on the table that staff are spending a lot of time on, both for the purpose of recording them in the clinical record, which is incredibly important, as you all know, for the clinical value of some of this, but also because we want to make sure that we're drawing down that financial benefit. And so what we've done here is laid out all of the different delivery methods that targeted case management can be provided by. So it can be face-to-face, it can be by telephone, it can be by telehealth. And the part that I think is most difficult for folks is who needs to be involved in that service. A member can be involved, obviously. That is, kind of the most primary person who will be involved in this service other than the provider themselves, but also significant support people and the care team. And so support people can include the member's family, teachers, school staff, other professionals that don't work for your organization or agency, but also can include the care team. So the people that providers are working with day to day that share members. And so we've left some little notes here regarding some of the limitations around the significant support people and how it's really important that those conversations be truly linked back to the member, even if they're not with the member themselves. And also some little notes about supervisors. So this is kind of one of the grayer areas where there is a little bit more judgment required from the county and the quality team itself, but often counties have decided to not have staff record similar activities discussing the member's progress with their direct supervisors in the event that be considered part of clinical supervision, which is something that we don't want to be getting in the way of. So the takeaway here is really make sure that you and your guidance is getting the full picture of what is allowable for these services. And that way we are not just getting the most common way that the service is provided, but all of the different permutations of what is going to be allowable. If we go to the next slide, this is a really key part of the training. We all know what are the required elements of a progress note laid out in BIN 23068, but it's really key that staff be able to see what this looks like in the EHR. And so this is an example note that the current BHRS team so kindly provided us with, but make sure that as you are creating trainings, you have visuals from the EHR itself that will reflect what the staff will be seeing as they enter in some of this information. There are a variety of ways in which counties and CBOs have offered templates for making it simpler to write a progress note, and that's something that you should take into consideration as well as we try and remove some of the barriers for staff to actually write these notes. As you all are probably aware, targeted case management is one of those services which can take a very short amount of time. It is going to be bits and pieces of someone's day. Very rarely will it be in a large block of time. And so it's really important that we make it easy for staff and make it seem worth it to staff to record that time, even when it is, just over 8 minutes, even if it's not. And that's still really valuable information if captured in a non-billable note for you all to have as you work to create these trainings, to identify where additional help is needed. And the last thing that I want you all to consider as we think about not just identifying what targeted case management is and when we should be writing a progress note, but also making sure to incorporate into trainings some element of interactivity. And so what that could look like is presenting a scenario or a vignette of targeted case management, and then having staff try out writing a progress note and going over what that example looks like together, what good looks like, what maybe not so good looks like, and how to improve those versions to be what you all as leadership, as quality professionals are expecting. So not just showing off, the one perfect example, but also teaching staff how to get there and, doing a little bit of that testing within the training. If we go to the next slide, this is something that we have also found is really critical to include in targeted case management trainings in particular. There are a lot of activities that are so close to targeted case management, but can't reasonably be included in a billable note. And so for some of these things, what we want to do is not just make the words pretty so that it fits on a progress note and gets approved, but really make sure that we are offering staff an approach to shifting what they're doing and improving the quality of that service they're providing to make sure it's a very valuable service. And so this is another area where you will want to make sure that examples are matching your county policy, but help staff to shift into that mindset of not just how do I make this sound nice in a progress note, but how do I do something that is really valuable for the client, for the member, that will look good in a progress note. And so what we've done here is gone through some examples that we have heard from staff and considered with the quality teams what can be done next time to make it a true targeted case management service. And what is really important here is connecting the intervention to the member's behavioral health needs, to the problem list when possible, explaining where needed why professional support was really key to getting this done. And if there are any of these activities happening that, maybe don't totally align with what we see as the true definition of targeted case management, making sure to note the duration of the qualifying and non-qualifying activities. We want to be capturing everything that's happening, but not everything will be included in that billable duration. All right. If we want to go to the next slide, again, those are just a subset of the full materials that we'll be providing you all with, but it's really important to be coming back to some of these best practices when you're building your own county-specific version, adapting kind of the starting point that we have given to you all. So the first piece, and we have been going through this as we've gone through the slides, but make sure that you are tailoring the examples that you give to staff based on what the connections and referrals typically look like from your organization. So make sure that they reflect what staff are going to be connecting folks to day to day. Sometimes what that means is creating different versions of the training for different roles or for different teams. And that can be really valuable and go a long way in making the trainings usable and actually accessed by staff. Like I mentioned before, something we see really often is that unless it feels very specific to a staff person's role, it won't be referenced. We'll kind of tune out some of this. I think we have all heard or had the experience of being in a training and we hear, one word and then we're kind of out and, going on to whatever else it is. Email, another click-through training. And so having that role specificity, that program specificity in the examples can really help staff take it from, ingesting this information in a training to acting on it. The second piece is be really explicit about the delivery methods. Be clear about the things that you have seen go wrong as you are reviewing charts, as you talk to staff in your own organization, but make sure you lay out everything that is billable and your expectations for what is being recorded. Targeted case management is one of the more special examples of this because the member's involvement isn't always required, but this is going to be something that will be valuable across all services. Also really important to offer ways to shift service delivery. We don't just want to be creating the perfect progress note that isn't linked to an actually valuable service. We want to make sure that clients are receiving the service as the federal government and the state guidance intends. And so in addition to making sure that documentation is really clean and compliant, making sure that the delivery is valuable for the client and ensuring that our trainings are very attuned to that nuance. In the bottom left, this is something that really goes along with role specificity. So this is going to look very different for an LCSW versus a mental health rehabilitation specialist. But making sure that the activity examples that you give reflect those workflows. Again, it's not going to be super helpful to have this long list of activities that is kind of jumbled across all of the different ways that you have assigned your workforce to different tasks. So where possible, make sure that examples are specific to certain groups and remove the ones that aren't, add some that may be more relevant to who you're trying to give the training to. This final piece is going to be providing example progress notes. And so it is all well and good to have that perfect example, but make sure that in addition to that, you're incorporating some element of interactivity. So have folks write a note, share with the group, edit it together until we have something that reflects what you all as leadership or quality team members would expect to see. Again, the materials that we will share were created to fit all of these recommendations and best practices for one county, but it should really, they should change based on what your desired audience is going to look like. If we go to the next slide, we wanted to share a little bit of what the process actually looked like for creating some of these materials. So what we did with this county that had a dedicated training team, but can really be done anywhere if you have some of that bandwidth. And so the first part of this is just going to be a really close reading of the state and federal guidance. So reviewing the state definitions, analyzing what the federal guidance has said, and then trying to map some of that language onto what it looks like in the real world workflows. And this is a really key part of it, but making that bridge between what your staff are doing and what the guidance is saying, because that is the really hard part for staff. And so helping them along on that path to kind of connect some of those relevant examples is going to be key. What you should have after this first step is you can have that first draft of the training materials. Beyond that, you're going to want to review that. So make sure you identify where there is conflicting information, where we're seeing something different in the training materials, if there are areas of concern between the state and federal guidance, and make sure that your quality team, that whoever is creating these materials is really in alignment. The second piece of this is going to be making it really specific. And so creating some of those vignettes, those sample progress notes can come later down the line than those initial pieces of guidance that are based on what the state and feds have said, but really making sure that it will be an interactive training and not just you all talking at the staff. The final piece of this that we found to be incredibly helpful and informative was actually testing out the materials before you push them out to the organization. And so this can be with a select group of folks. Maybe you want a focus group of different staff who have varying levels of success in documentation. So you want the folks that are really good at it, really fast at writing progress notes, that are clean and compliant, but also the people that struggle a little bit more. And so having that breadth of experience will help you to create materials that are not just aimed at one group of people. Another thing that will be helpful here is also, if you are coming from the county perspective, really taking into account what your contractors are struggling with as well. This can be a really good opportunity to bring in some of their perspective and get some of their thoughts from staff. Depending on who you plan to present this training, it can also be helpful to bring in some of your leadership from the supervisory level. So folks that have direct service staff reporting directly to them. This is going to be very dependent on what it looks like for your organization, but it's going to be really key for you to, bring in some of that perspective as well, if you're going to be expecting folks other than yourselves to provide that training. If we go to the next slide, we have a couple of examples on how we can try and make some of this training stick. We hear all the time that counties, that other organizations really spend a lot of time on training, but don't necessarily see the results, the actual change in progress notes and billing after that. And so what we recommend is offer live trainings if possible. Obviously, we are doing this virtually, but it can be easy to lose an audience when you can't see folks, when it's hard to interact and have that two-way dialogue. Another thing that we have already mentioned is going to be trying to make those trainings really interactive, whether that is with polls, with little before and after quizzes, exercises like writing a progress note, reviewing together, but really just trying to start working that muscle of connecting the activity to the writing of the progress note and making sure that staff are able to identify when targeted case management is happening because it can be really ambiguous compared to other services. The next piece is going to be, again, using real world examples, things that staff will encounter day to day, recognize in their own workflows, and also, as possible, make sure that it feels relevant to your membership. So if there is a program that tends to do a lot of referrals to housing, you can even list out some of the organizations that direct service staff might be involved with. Another piece is try and reference the common mistakes that you have seen in documentation or heard confusion about from staff. So make sure that you are calling out these examples, which of course are going to be really specific to your organization, so staff know what to avoid, what is often an issue, and also how to fix those problems. The final piece is, in addition to offering trainings live, make sure that the reference materials are stored in an easily accessible, searchable, and central location. There is a lot going on in all of your organizations day to day. There are a lot of clients with different needs. And so making sure that it is easy and quick to access some of this information when staff have a question about how to document is only ever going to increase the likelihood that they will actually document. Again, targeted case management can take a very short amount of time, 8 minutes, 9 minutes. And if some staff feel that they will have to be documenting for an equivalent amount of time, it takes them 10, 20 minutes to write a progress note, it's not going to be likely that they will write it. So we want to make sure that it is easy for them to get their questions answered when they have them. All right. If we go to the next slide, we have an opportunity for questions. I will preface that it is going to be, we will have some context-specific questions. All right,
And
so
Naomi, we do have a question in the chat.
yes.
I don't know if you can read it, but it's asking about a TCM activity provided during a larger individual therapy or rehab session. And the question is, would you recommend writing two separate progress notes, or can the TCM activity and therapy rehab interventions be included in the same note?
Great question. This will again vary from county to county depending on county policy. What I would say here is you want to be incredibly careful that you are not billing for the same amount of time twice. And so in this situation, I think most counties would likely recommend that you mention it in the same note and not write it out separately because it sounds like it's happening in the same period of time, which is already going to be recorded. That's a great question. And so what it sounds like from this context is that this should likely be one note, but make sure to separate it in some way, just so that it's clear that there was another element to the service you were providing. Great question. And we are happy to take other questions from folks. We will also have an opportunity in the survey we share shortly to ask questions that may be outstanding after this short session. But I will give folks a moment to type if there are additional thoughts out there. Okay. I am not seeing any more questions in the chat. We will still keep an eye on it, but if we want to go to the next slide, actually one more slide, we have an opportunity for you all to provide some feedback on this session, which we would very much appreciate. This is also where you are going to be able to ask additional questions if you have them. I will go ahead and also share a link to this survey in the chat in case it is easier for folks to respond on their computers rather than your phones, which you can use to access the QR code that is there. But thank you all so very much for attending. We are going to be looking forward to hearing your feedback on this, and the training materials that you got a little sneak peek at will be available later on. All right. Thank you all so much. And Teresa, I'm not sure if you have anything additional to close out with, but we very much appreciate the opportunity to share some of the great work that counties have been doing.
Yes, agree. Thank you so much for everyone for joining us. We appreciate any of your feedback that you have. And again, if you do have any additional questions, feel free to reach out and have a nice day. Thank you, Naomi.
Thank you. Bye.